Everyone, welcome back to my channel, The Nice No Scares. Today, we'll be talking about cholecystitis. Cholecystitis is inflammation of the gallbladder. It could be acute or chronic. Acute cholecystitis is usually associated with gallstones, and another name for that is cholelithiasis. Chronic cholelithiasis occurs when there is insufficient bile emptying, and it is not usually associated with gallstones. Chronic occurs when there is stasis of bile in the gallbladder. When the bile is not emptying properly, the bile starts accumulating in the gallbladder. Inflammation of the gallbladder has occurred over a long period of time. This can result in chronic cholecystitis. The gallbladder is a sac that stores bile. Bile breaks down fat so that it can be absorbed by your body. Cholecystitis can also result when there is no stones in the gallbladder, and this is called acalculous cholecystitis. That is inflammation of the gallbladder without stones. What are the risk factors? The risk factors are being female and being obese. Because of accumulation of fat in the body, the fat can also go and deposit in your gallbladder, leading to gallstones. Estrogen helps our body to accumulate fat, and when the fat are not broken down, it can accumulate in the gallbladder and lead to gallstones. What are the signs and symptoms? The signs are what you can see as a nurse, and the symptoms are what the patient tells you. Most of the signs and symptoms are usually associated with the gastrointestinal system. There is nausea and vomiting, anorexia, belching, flatulence, and then there is pain, epigastric pain that radiates to the shoulders. Pain is localized in the right upper quadrant because the gallbladder is under the liver and is situated in the right upper quadrant. The pain is triggered by eating high-fat diet or high-volume diet. A mass may be palpated in the right upper quadrant. And then there is positive Murphy sign. How do you elicit Murphy sign? You put your hand under the ribs, that is close to the hepatic margin, and then you ask the patient to take in a deep breath. The patient takes in a deep breath, but midway the patient stops because of pain. That is positive Murphy sign. There is sign of fever because of the infection. There is elevated temperature and there is tachycardia, fast heartbeat. When there is biliary obstruction, there will be jaundice, yellow discoloration of the sclera. There is pruritus, itching of the skin. The urine becomes dark and frothy, and there is steatorrhea, that is passage of bulky, fatty, clay-colored stool. The gallbladder and the liver are pals. They work together. As a nurse, what is your role regarding this patient that has cholecystitis? Place the patient on Nil-Pi-Ora according to doctor's prescription. An NG tube may be passed to decompress the stomach and to rest the gastrointestinal tract. And then you give prescribed antiemetics. You also give prescribed anticholinergics. Anticholinergics are drugs that relax smooth muscles. And in case of chronic cholecystitis, instruct the patient not to eat fatty food, and then to eat food in small bits at frequent intervals. Administer prescribed analgesics to relieve pain. When the stone is removed surgically, it is called cholecystectomy. And in cholecystectomy, it could be open surgery or a laparoscopic surgery. Instruct the patient on what to expect post-operatively if the patient is being prepared for surgery. That is cholecystectomy, the removal of the gallbladder. Then another surgery that could be done is choledocholectomy. That is incision into the gallbladder through the abdominal wall to remove the stones. As nurses, you monitor for post-operative complications relating to respiration. Because of the pain, the patient finds it difficult to breathe in deeply. So you watch out for respiratory complications like rapid breathing, tachypnea. So you assess the patient frequently and watch out for these signs. Teach him how to split his abdomen when he wants to cough or taking a deep breath. Encourage the patient to cough and do deep breathing exercise. Encourage early ambulation. How important early ambulation is to prevent post-op complications like thromboembolism. Listen to bowel sounds. Place the client on Nil-Pi-Ora. Monitor NG tube drainage and document. Commence patient on oral sips as prescribed by the doctor and advise to solid diet as tolerated by the patient. A T-tube is placed after surgical exploration of the common bile duct. The T-tube preserves the patency of the duct and ensures that there is drainage of bile until edema resolves and bile is effectively draining into the duodenum. A gravity drainage bag is connected to the T-tube to collect the drainage. So what are your nursing interventions for a patient on T-tube? You place the patient on semi-fowler position so as to allow the fluid to drain by gravity. You monitor the output, the amount, the color, the consistency of the drainage. Even the odor of the drainage is also monitored. If it is foul smelling, that means there is sepsis. So you don't want the patient to have sepsis. It will complicate his condition. So you watch out for the drainage and record. When there is significant change in the amount of drainage, you report to the HCP. Monitor for inflammation and protect the skin around the drainage because bile is an irritant. It could damage the skin around the drainage and that could lead to more pain or problem. Keep the drainage system below the level of the gallbladder. Never allow the drain to move backwards. Avoid irrigating the T-tube or clamping the T-tube without the doctor's prescription. As prescribed, clamp the tube before a meal and observe the patient's reaction to the clamping. Is there abdominal discomfort? Is there nausea and vomiting? And report this to the HCP. So you watch out for complications of cholecystectomy like sepsis. How you do this is that you try to prevent all these complications by assessing the patient regularly and monitoring the patient, even recording all your vital signs so that when there is significant changes, you can quickly detect this. Thank you very much for watching. See you in my next video.